Hi, I'm Dr. Richard Lackman. I am an orthopedic surgeon with a specialty in orthopedic oncology. Today, I would like to share with you some of what I've learned to help you succeed in your career and in your life beyond medicine. To succeed in medicine, the following are necessary: a strong science background, extensive clinical knowledge, manual skills for procedures or surgery, a firm ethical base, keen judgment, compassion, an intellect stronger than your ego, the ability to keep thinking, and a commitment to your career. All of this is necessary but not sufficient for success as a physician. This is because we're not just treating diseases, we are treating people. And indeed, we are people ourselves. As such, our job is to treat diseases while supporting the psychological well-being of our patients. The key to doing this well is simply concern. Fortunately, this is the same concern that motivated most of us to become physicians in the first place. People are complicated, as are their disease states. So, to deal with the complexities of modern medicine, you need a game plan. 1, to maximize your accuracy. 2, to maintain efficiency. 3, to build a practice. 4, to maintain your own equanimity. And 5, to facilitate success in important personal relationships. In order to maintain your own equanimity as a physician, you first need to understand yourself. So take time to understand your own physical, mental, and emotional strengths and weaknesses. Understand your own priorities in life, such as your family, hobbies, and commitment to your practice. Try to balance these commitments, but realize that this balance may not succeed every day. Remember that your career is important, but not more so than your family. Not every personal relationship can stand the test of time, but as in medicine, success in the family requires lifelong learning and commitment. Understand also that the more you can place the needs of others above your own needs, the easier it will be to maintain happiness. Happiness is a skill you can master, but not a product you can buy. Practice being happy. I have certainly experienced many physicians who are unhappy for no good reason, because they continually compare themselves to others who have more of whatever. There will always be others who are more or less successful than you are. Every day, count your blessings and be grateful for everything you have. Gratitude is an effective happiness expander, so use it liberally. Effectiveness in practice is paramount, as is efficiency, but you need to pursue efficiency safely, always prioritizing the needs of your patients. In your practice, keep your brain 10 steps ahead of your ego. Consult with partners and others to help guide you. Seek appropriate help for difficult cases. Even the most talented physician is still just a person, struggling to do his or her best. Humility will benefit both you and your patient. The next ring of complexity around you is the clinical context in which you practice. Make sure that your staff understand your commitment to your practice. When I go on vacation, I still try to call the office every day to remind the staff how important my practice is to me. They will not care more than I care, so I remind them that I care a lot. Thank your staff when they do things well. Help them understand how to improve when problems happen. Your pride and patient satisfaction will be mirrored by them as they begin to feel pride in working with you. You also need to understand how your practice fits into local and regional medical care and where your patients come from. You may want to become active in various local groups. This will help support referrals to you and also support your position as a leader in your community. Remember that availability is the most important aspect of practice building, followed in turn by affability and ability. And always remember, Your reputation is your most valuable asset. Finally, it is essential that you understand how to optimize your interactions with patients. Medicine can be thought of as theater with an audience of one. Each time you enter an exam room, you are on stage, and your performance is being evaluated as if you were an actor in a play. Considering this, you need to actively, not passively, project warmth and concern. Beyond that, you need to sit eye to eye with your patient and listen to what they have to say. Understand that the greatest challenge in practice is to have the discipline to keep thinking every day. Again, never stop thinking. I have found it beneficial to ask myself about each patient, what is the worst it could be? And at that point, pursue any real possibilities. It occurs to me that if people want God to care for them, they need to go to heaven. Down here, it's just us. Strive for perfection, but acknowledge that there will be failures and prepare to deal with these technically and emotionally. Always ask patients if they have further questions. It is important that they leave your office having had an opportunity to voice all of their concerns. Also, inform patients that if questions arise after they leave the office, that these can also be answered and facilitate this process. Personally, I have no problem giving patients with significant diseases my personal cell phone number, though they do not expect this level of commitment. But if patients have a significant disease, then I want to be accessible to them when they need that access. Interestingly, while patients appreciate receiving my cell phone, they rarely ever call, even when I think they should have called. When I ask them why they did not call, they say they did not want to bother me. So I need to reinforce my willingness to be available to them as the need arises. In speaking with patients, there are several key phrases that can help them understand your commitment and concern. Many patients will wonder what you would recommend if they were members of your family. As such, I honestly tell patients, this is what I would recommend if you were my family. It is also important to directly tell patients, I will take good care of you. I have had many patients tell me years later that they felt relieved after our first encounter because I assured them that I would take good care of them. Likewise, I honestly tell patients that the doctors I refer them to are ones that I would go to or have gone to myself. I remind my patients that in the course of daily life, I have the same guarantee for tomorrow that they have, which is 0. Again, life for each of us happens just one day at a time, whether we're the doctor or the patient. While there are many regulations in modern medicine, there is no regulation that prevents you from going out of your way for your patient. I recall a patient who required multiple post-operative visits for wound care following radiation and surgery for a soft tissue sarcoma. This 85-year-old gentleman lived 2 miles from my vacation home, but 80 miles from my office. As such, during his post-operative care, I made several visits on Saturdays to his home to help him with dressing changes. This really did not amount to much on my part, but meant the world to him in terms of my relationship with him and my commitment to his care. Obviously, this was not a routine part of my practice, and most patients I have seen have been seen in my office. But again, always keep in mind that there is no limit to what you can do for your patients. Finally, continue to foster your passion for your career, but do not let the burden of care place an undue burden on your own happiness. Understand the positive implications of your interactions with patients, but also know the limitations you have as an individual to change the course of some diseases. Strive to understand that for each of us, as for our patients, life happens one day at a time, and each day is a blessing. Remind yourself each day that life is a blessing, your family is a blessing, and your career is a blessing. And so, With all these blessings, it only makes sense to be happy.